Hi, STXBP1 community. My name is Kate Haldeman, and I support community partnerships at Citizen Health. I'm excited to share a little bit more today about what is Citizen Health, why we're partnered with the STXBP1 community, how you can get started, or if you are already on the platform, some really exciting updates for you about new features and value for the experience. And then next steps if you want to learn more and ask any questions that you have for us. So maybe to start out first, I wanted to share a little bit more about why Citizen exists and what we are trying to do in the rare community space. So pictured here is Nasha and her family. Nasha Fitter is one of the co-founders here at Citizen, and she is mom to Mara, who has a rare neurodevelopmental condition called FOXG1. Amara was diagnosed around 10 years ago, and it became very clear to Nasha and her family that the current health system is not suited or built for families and patients with rare conditions, right? Patients and families with rare conditions need more personalized care. They have incredibly high cost, high burden community, and the current research approach for advancing drug development for rare disease is very burdensome on the family and costly for the community as well. So all that to say that current models were falling short, and Nasha did not want to stand and wait and watch the time slip by. So she started Citizen Health, both to accelerate research and drug development timelines for patient communities, and to finally give comprehensive medical history for everywhere that your child has received care. Starting from day one, you can use your own personal AI advocate in our secure environment to get personalized insights about your journey and next steps. And then, if you choose, you can consent to power important research led by STXBP1 and relevant researchers that are shining a light on the condition and pushing forward treatments and drug development. As always with our platform, we have a few core principles that are very important to us. Pictured here is our Chief Regulatory Officer, Devin McGraw. Devin is one of the ones that penned the HIPAA right access laws in the United States that still, protect the patient right to their own data today. And so with that, one of our core principles is the patients own and control their data. So the medical data that we collect on your behalf, it's yours, it's in your profile. You choose if and how it gets shared or not at all. All data is secure and de-identified when it's shared with your consent for research purposes to protect your identity. And that also you get compensated if your data is shared for a commercial research program. We've actually shared back over $1 million to date with the rare disease community as part of our revenue share model. So I wanted to give you maybe a little bit of a deeper look on what the patient experience actually entails, and you can also follow along in signing up as I sort of walk through some of this context here. So as part of our partnership with STXBP1 Foundation, you would get started via this landing page here. So if you go to citizenhealth.com/partners/STXBP1 Foundation, you can sign up here, and then you'll be prompted to is you can click on that link and download our new app, available on iOS for US users, and sign up. As part of our sign up process, you'll create a username and password. You'll enter in some basic demographic information. Let us know where your loved one has received care in the US, and then you finalize your profile. Once you finalize your profile in that short onboarding process, you'll open up your citizen dashboard and your experience here. A couple things you can do right away um, is get oriented to your platform. You can start chatting with your AI advocate. Over the course of the next several weeks, you'll see your records starting to populate as we complete those medical record requests from the providers. You're able to share your health records with whomever you choose via the sharing feature in your profile. You can always add new providers when you want to update your medical records, or you can even upload your own medical records as well if you want to have everything in one place, and maybe there's some things that you have saved, on your own for your own purposes. In terms of chatting with the AI advocate, that's something you can do from day one, and it only gets better as your records start to populate. And again, this is your personal advocate in your pocket that knows your child's medical record history, that is, you know, built to bring you some relief throughout your care journey. Everything from asking it to summarize your child's medical history if you're going to go see a new provider and you want to be able to provide that ahead of time, to, give me a list of all of my child's medications, when they started and stopped, and what's the dose. There's so much cognitive load as a caregiver that you carry around with you all the time. Now you finally have a companion that really can access your own child's medical record history with confidence, and give you the answers that you need in the moment that you need them. I think very excitingly and importantly, we are now available on mobile and with a number of new capabilities. So the AI advocate can now be your personal note taker and recorder during your care appointments. So you can bring it with you and record care conversations with your doctor and your care team, so you never miss a beat. And then all of that gets stored in your profile that you can always query later. So you can check it out in the App Store on mobile as well. Again, just the idea of having everything in your pocket when you need it, where you need it. We're hearing a lot of great feedback on the AI advocate from the community. Everything from helping to folks prepare for IEPs and insurance appeals, to just the pure ease of being able to access all of their medical data on their phone, without needing to carry around that big medical record binder that many of you probably have. For those that are outside of the US, you're still welcome to onboard. We have our onboarding and consents translated into several different languages. The only difference is we're not able to collect medical records on your behalf. So you would have to upload any medical records that you would like to the platform if you wanted to interact with its features and the AI advocate. To give you a sense of what it's like to have a chat with the AI advocate, you can use one of our preset conversation starters, or you can ask your own question in the chat box on your profile. So for example, if you want to get ready for an upcoming appointment, you can select that chat conversation. It will drop you into your conversation window with the AI advocate. And then it can very usefully pull up information about what would be the best place to focus on for your next care appointment based on your child's medical history, or the things that are really top of mind for you. So in this example, we're getting ready for an appointment with Dr. Porter, who is Amara's neurologist. And, in this example, we said, can you take a look at the notes from our last appointment and everything we discussed, and help me figure out where do we pick things up based off of, my priorities and what we discussed last time. And it very nicely outlined some of the things to bring, targeted questions to ask. And then, of course, in the meeting, you can then share this. Actually, you can share this directly with Dr. Porter as part of our share functionality on the platform, and then even record the care conversation so that that can be integrated into your follow-up and your even the next meeting that you have with Dr. Porter or another care team specialist. Many other things you can do as part of something that unfortunately, right, does happen quite frequently when we're, trying to get coverage for certain things. We see this a lot with adaptive equipment, for example. In this situation, we asked AI Advocate to help us prepare for an insurance appeal when Amar was denied, in this example, an adaptive bicycle. And then it created a full appeals letter that specifically cited the necessary information in the health history of the patient, to help render that appeal. So all this done with, a few quick seconds in chat, pulling from the actual source that's needed for these types of activities. Of course, I wanted to spend a moment on privacy and security. It's really our paramount at Citizen, and what we have built the entire platform around. Our key principles here, again, of that patient's own study that's done, any research that's done, is compliant with our federal human subjects research rules and IRB requirements. The model that we've created here in partnership with the rare disease communities, to essentially unlock the insights that are trapped in the medical record data of a lot of great work to bring drugs to market, but quite simply, in traditional models where a patient has to go in person into the clinic to visit over several months, many times, not every family can can participate in that way. It's very expensive. It takes a long time. So to have a more innovative model whereby essentially a schools of how rare communities have really accelerated drug development timelines using digital natural history data and this innovative approach, whereas traditional models could take much longer and more significant investment. So as part of Citizen, we partner with the communities to invite families to join, and those that participate in research were able to collect their comprehensive medical history from everywhere they received care. So suddenly, right, we have the disease journey for all of the community members that are on the platform. And then we're able to actually take those raw medical records for consenting patients and extract the most relevant information from the raw medical records to create these very usable, research-rich, and research-grade data sets that help researchers, help industry partners and drug developers really understand the progression of the disease, the important questions they have about endpoint selection, or other elements related to the drug development process in a way that they, would have had to take, many years and even sometimes millions of dollars to do if they tried to do this in an in-person context. And so we have found that the digital natural history data we're able to collect in a very patient-friendly way has, digital natural history study for Citizen. We've had similar success stories. For example, the SCN2A community powered their IND filing utilizing the Citizen natural history data and accelerated their ASO drug development timeline by 4 to 5 years, which is an incredible timeline acceleration for children that very much want and need access to this therapy. And so we're very proud to partner with the STXBP1 Foundation to support a variety of research efforts. Your participation has already helped drive some really illuminating research, for example, in this journal article in Brain around delineating clinical and developmental outcomes in STXBP1. And we're excited for future publications and research that can be powered by your participation. So in terms of what comes next, please do consider taking just a few minutes to sign up if you haven't already. And if you have signed up maybe a while ago, please come back and log in, check out the new features, use the AI Advocate, let us know what you think. If you haven't updated your providers recently, we do recommend taking a look at that about every 6 months, or if you've had a major change in your care, to let us know if you've been seeing a new provider so we can ensure you have the most complete medical record history. And we're always looking for folks who are excited about what we are building and want to become a user tester, be one of the first folks who download our mobile app and give us feedback. We, again, are building tools for the rare disease community, and we want to make sure that your voice is heard. So we value that tremendously and would love for you to get in touch. So again, thank you so much for your time. Please do not hesitate to reach out to the STXBP1 Foundation or Citizen Health if you have any questions, and we hope to see you on the platform.